sometimes the cords can get loose and they will sometimes spark. So make sure the light bulb and everything is tightened here first, okay, before you turn that on. We once had a little, and then the fan needs to be on. I'm not going to turn the fan on. So this lab engine, to work this turns it on and off right here. Okay, you have an option to be hand controlled or foot controlled with a foot pedal. We don't have the foot pedals out, thank you, so that you'll use it by hand. So you can see here that the hand is lit up. Okay, if you were going to foot control it, you toggle it over to foot. It also goes in forward or reverse. We just want to go in forward. Okay, so this here, that's the speed. That's controlled by this dial. I really don't think you're going to need to go above 10, so 10 should really be your max. And honestly, if you only have a little bit to trim off an area, you probably want to keep it lower. You can always take more off, or once it's gone, you can't put it back on, okay? So you might want to even keep it lower than 10. You have options for a couple different types of burrs. So you have the pineapple burr here that you learned about with the hand pieces, and then we have a tapered burr that works really well for the margins of some of the smaller areas, okay? So these are lab burrs. For the hand piece, how these go in is this turns, okay, to tighten and loosen. So you're gonna open it up, put the burr in all the way, turn it, always pull to make sure that it's locked and that the burr is in before you turn it on, because you don't want it to start spinning and then the burr comes out. And you're going to pretend that this vent is running. This is going to stay down. And you're going to hold this. I'm going to shut this off for a second. You're going to hold this like you're peeling a potato. So it's like in a palm grasp, okay? So you shouldn't be in pen grasp when you're doing this. You're in like a palm grasp like you're peeling vegetables or a potato, okay? It's Thanksgiving and you're helping prep the meal. So you're holding it like this, okay? Now I'm going to mark. I have my areas that are marked, so I'm going to just hold this and remove that material, remove that excess. So I'm getting that flashing here, but I don't want to touch, remember, that direct contact. And if I'm afraid that too much is coming off, I'm just going to turn this down a little bit, lower my speed a little bit. Now, you're either going to bring your Typodont over here, or I'm going to have to go back and forth, because I would keep trying this in my patient's mouth, okay? I also want to make sure that I don't have any sharp edges, because if it's sharp to me, it's certainly going to be sharp to the patient's tongue. If you have a lot to remove, you're probably going to want to start with the pineapple and then move to this tapered. So there's a burr brush sitting right here. So once you are done, you want to make sure and I'll set up a couple of these stations around the lab, but you want to make sure that you are using that burr brush to clean out the burrs when you're done, and cleaning this dust collector out as you finish, okay? Just getting those good habits. If somebody wouldn't mind grabbing my patient so I can just try this in, please. Looking is to try it in, okay? And then I'm gonna see, so I'm gonna adjust a little bit more on that buckle there. I can see I kind of still have two little sharp points. And then one of the main things that students have a hard time points of the mesial and the distal, that line angle right under here, that's one of the areas that students will forget about, and it ends up looking like a block, like that whole contact is filled in, and you wanna have that embrasure. So you're gonna need to go in and contour probably here a little bit, and you can see on the distal how it's blocked right there. Same thing there.